Hi everyone, today I'll be sharing about kidney-related diseases. First thing first, Polycystic kidney disease (PKD) is an inherited disorder in which clusters of cysts develop primarily within the kidneys, causing the kidneys to enlarge and lose function over time. The symptoms include blood in urine, high blood pressure, headaches, and more. The main and only cause of PKD is due to genetics, which are the autosomal dominant PKD and the autosomal recessive PKD. Autosomal dominant PKD is when only one parent needs to have the disease for it to pass to the children, while autosomal recessive PKD is when both parents must have abnormal genes to pass on this form of the disease. There are a few measures that can be taken in order to overcome PKD or to reduce its symptoms, which are dialysis, consuming antibiotics, kidney transplants, consumption of blood pressure medications, and consumption of tolvaptan tablets. Next, chronic kidney disease (CKD) is defined as the progressive and irreversible damage to the kidneys that over the course of months or years can lead to kidney failure. There are 5 stages of chronic kidney disease. The first stage is where the kidney damage is about 90% where it still functions normally. The second stage is when the kidney damage is about 89 to 60% and have a mild loss of function. The third stage is when the kidney damage is about 59 to 30% and have moderate to severe loss of function. The fourth stage is when the kidney have severe loss of function and have kidney damage about 39 to 15%. The fifth and final stage is when the kidney damage is about negative 15% and suffers with kidney failure that needs treatment to live. Ckd signs and symptoms include fatigue and weakness, sleep problems, nausea, vomiting, and more. There are several causes of CKD, which includes diabetes, high blood pressure, obesity, and more. There are 2 types of treatment done for CKD patients. This includes the purification of blood artificially, which is also known as dialysis, and it is a lifelong process. The next treatment will be kidney transplantation. Next, we have urinary tract infections. UTI is a disease caused by infections in the urinary system, mainly by bacteria. UTIs can be further classified into 2 groups, which is the upper tract infections and the lower tract infections. Upper tract infections mainly affects the kidney, while the lower tract infections will consist of the bladder and urethra. The common signs and symptoms are frequent urination, dysuria, cloudy, bloody urine, and more. Since this disease is caused by bacteria, the prime treatment will be antibiotics. The antibiotics is given for 3 to 7 days depending on the infections. Don't stop taking the antibiotics because your symptoms go away and you start feeling better. Last but not least is glomerular nephritis. It is an inflammation of the glomeruli, which are small filters in the kidneys. Acute and chronic are the 2 forms of glomerular nephritis. The acute form has a sudden onset and may develop after an infection, but the chronic form may appear gradually over several years with no symptoms and often leads to kidney failure. Signs and symptoms include blood in urine, foamy urine, high blood pressure, and more. In terms of the causes, this includes infections, autoimmune diseases, vasculitis, and other forms of conditions. Lastly, for the treatment of glomerular nephritis, this includes dietary changes, whereby usually in mild cases, a change of lifestyle is advised. This involves limiting the intake of salt and potassium-rich food and drinks. Next are immunosuppressants, which are normally used for severe glomerular nephritis caused by autoimmune issues. Lastly are antihypertensives, which are used for glomerular nephritis caused by hypertension. These medications will help to lower your blood pressure. That is all. Thanks for watching.